Thank you for taking the time today. I want to show you how data can be organized to impact how your organization is managing cost and outcomes. Let me start with a number. Over $1 trillion. That's what Medicaid spends annually across the United States, and a lot of that spend is driven by preventable complications. Chronic conditions that better data intelligence would catch before they escalate. The same pattern plays out across diabetes, chronic kidney disease, heart failure, and behavioral health, every major chronic condition your program covers. Over $1 trillion in spend, and every dollar of it is manageable with the right data organized and delivered timely. Here's the harder problem. Most state Medicaid programs don't have a real-time view of what's driving that cost. Claims, clinical records, pharmacy data, lab results, they exist, but they live in silos. By the time your team sees a trend, it's already a crisis. And limited visibility means fraud and improper payments are happening in blind spots your team simply can't detect. My name is Kenneth Perry, Managing Partner of Optimize Health Partners. We built our platform specifically for this problem. At its core is the omnipresent EMR, a live AI-enhanced electronic medical record system that's HIPAA-compliant and state Medicaid ready. Layered on top is our Analytics Suite 19 condition-specific dashboard modules that surface actionable intelligence in real time. And HEDIS reporting is built in natively quality metrics, and regulatory submissions happen in the same workflow, not bolted on afterward. The analytics layer is where the platform earns its value. We have 27 modules organized across 4 areas, and together they cover everything a Medicaid program needs to manage cost, quality, and compliance. Tier 1 targets the highest cost chronic conditions, diabetes, kidney disease, heart failure, COPD, and more. Tier 2 covers the growth areas behavioral health, maternal health, oncology, social determinants. On the performance side, we have HEDIS quality reporting, physician-level analytics, facility performance tracking, and fraud detection. And the fourth column is what sets us apart from every clinical analytics vendor in this space, a full financial intelligence layer. Cost and expenditure trending, budget to actual variance, claims financials, IBNR reserve analysis, capitation revenue tracking, provider payment analytics, program integrity, and financial forecasting. All derived directly from your claims data, no separate finance system required. Here's what makes this different from a typical analytics vendor. We're not selling you a report. We're giving your agency or company a live operating system for population health management. When your team logs in Monday morning, they see which medical areas are deteriorating, which providers are statistical outliers, and where your dollars are being lost before it hits your budget, before it becomes a headline, before it's a crisis. I want to be straightforward with you. Optimize Health Partners is a new company. We currently serve one client. We're not going to pretend otherwise. What we bring is over 40 years of hands-on healthcare finance, clinical operations, and IT leadership. This platform wasn't designed by a software team that read a healthcare manual. It was designed by someone who has implemented Cerner, Meditech, TrackCare, Lawson, Oracle, and NetSuite inside actual health systems, and built complex business intelligence tools from scratch. I led the conversion of receivables systems for 104 hospitals at Health Trust without error. I led IASIS Healthcare through a full platform replacement of ERP, EMR, budgeting, Kronos, and Hyperion across 16 hospitals in 180 days with only minor corrections after go live. I implemented a full Oracle ERP, TrackCare EMR, and BI platform for a 23-entity health system in 12 months in the United Arab Emirates. We know what we're building. We've built it before. Let me be direct about how we compare to the vendors you may already know: Media Analytics, Gainwell, Health Catalyst, Arcadia, Deloitte, Optum, Oracle. Bigger is not always better. With them, you're looking at 6 to 18 months of custom build time, large consulting fees, and you're essentially paying them to build something that should have already existed. We are live in 60 to 90 days, and you'll see your first reports within 1 to 2 weeks of data loading. No IT project, no installation. We load your data, we validate it, we test the reports, and you go. Our pricing is subscription-based with a 6-month minimum, no surprise consulting invoices. And our dashboards weren't designed by data engineers working from a spec sheet. They were designed by someone who spent over 40 years running every functional area of a health system, including 2 different Medicaid HMOs. We are the only platform backed by a live electronic medical record. Here is what I want you to hear clearly. We are not asking you to take a leap of faith. We are asking for 180 days. Every state Medicaid program we have analyzed has millions in recoverable costs sitting in plain sight. Improper payments, preventable complications, fraud patterns hiding in claims data. Our platform finds them. Typically, within the first program cycle, the returns far exceed what the subscription costs. That is not a pitch line. It is what happens when you put real analytics on real Medicaid data. And the return is not only financial. States that identify deteriorating patients earlier deliver better clinical care, reduce preventable hospitalizations, and improve their HEDIS quality scores, all on the same platform. Better numbers for your program. Better outcomes for the people you cover. Sign up for 6 months. I am confident you will renew, not because you feel locked in, but because you will see exactly what this platform is doing for your program, and you will not want to go back to operating without it. That's the platform. What I'd like is 30 minutes on your calendar to walk you through it live, showing you exactly what your dashboards would look like inside our system. Can we get something on the calendar? We love our system and think you will too.